To close our day, and we appreciate you staying. I know it's a very long day, but so much information. We have something really special, which is the patient panel, and this is an opportunity to hear directly from patients and hear their stories and ask questions. But before we do that, something really quick. Last year, we presented an award called the LACNet's Above and Beyond Award. And this is given to individuals in recognition of their outstanding dedication to net patient advocacy. And the recipients of this award demonstrate an attitude of excellence, awareness, and hope for the neuroendocrine cancer community. The award is presented each year to an individual at the annual Los Angeles Net Patient Education Conference. So last year was the first year for this award, and we would like to announce the winner of the 2019 award, and Lisa is going to tell us a little bit about that person.
Okay. So this person we know is a musician and a lover of music. He plays at least 2 instruments, and I've seen him geek out myself over music, and he's very active in performing and sharing his love of music. Though he was recently diagnosed himself, he not only educated himself and advocates for himself, he jumped right into the NET community, getting involved in 3 different support groups in the local area: Los Angeles, San Diego, and Redondo Beach. And he helped us draft the first version of Net Vitals, getting it organized, and he also helped us get our internal listserv, the private email list, together. He became a Net Connect mentor right away, and has been reaching out to countless new conference attendees and other newly diagnosed people throughout the year. In fact, he went above and beyond with one in particular, one person who was newly diagnosed and was very overwhelmed. He helped that person get connected to a NET expert, and when he found out that that person didn't have anyone to go with him, he tried to arrange for someone to accompany him, and he became a really great friend and help to many people, to that person in particular, but to so many. And this person is Brent Curry, who's become a friend.
So Brent, you have gone way above and beyond, and we want to recognize you for all of your efforts.
Thank you, Giovanni.
We had to find a way to get him up on the panel and then know that he was going to be in the room so we could coordinate all this. So. Lots of secrets going on today. Okay, so we are really in our final stretch here with the patient panel. And these are all patients that we wanted to invite up because they were willing to share their story and also have very unique stories, and hopefully will resonate with some of your own stories. So if we may, starting with Cindy Lovelace on the left, please just say your name and maybe give a 1-minute intro on yourself and your history.
Sure. Cindy Lovelace. I live in Nashville, Tennessee, so I'm really excited to be out here on the West Coast. I was diagnosed with a neuroendocrine cancer in 2011. I am a PNET. My diagnosis was incidental finding. I did not have any symptoms. I was a breast cancer survivor, which is rather interesting. That was in 2005, and so I had an oncologist and I had a treatment protocol, and it had been very successful. And so I really thought I was done with cancer. And then in 2011 comes this incidental diagnosis. I They believe that the tamoxifen that I was on put me at a slightly increased risk of blood clots. I broke a bone in my foot. I was doing a lot of traveling, and possibly led to a perfect storm of developing blood clots. So I had a DVT, and then before I was diagnosed and went to the ER because I wasn't feeling well, and turns out that I had full blood clots in my lungs, and I was in the hospital about a week. And when they did the scan on my lungs, it just happened to pick up down in the lower quadrant an area that was around my pancreas, and they saw something suspicious. And so it began from there, and I had a really great oncologist who, she called me her red herring case, and so she was very persistent in sending me to different specialists to see what this little suspicious area was, even though everyone kept saying it's probably nothing. So that is how I was diagnosed. And I initially did not have a NET specialist. I did have a really good surgeon who did a great job in resecting, so I had a distal, as it was in the tail of my pancreas, and then took out my spleen as well. And didn't know to take out my gallbladder at the time, but it took a little time for me, about 6 months actually, to find a NET specialist through a Google search. And turns out he was right there in Nashville. And that's when I enrolled in a clinical trial for the gallium-68 and learned that I had a metastasis. So I've all that to say is that I now manage my cancer with a combination of surgery and looking at other therapies as well. But if not for me seeking out a specialist, when I was diagnosed. If I had not done that, I think I would be in a completely different place now. So I really stress, that having someone who really knows what they do, and they do it all the time on your case. Sorry, I took more than a minute.
No problem. I'll make up for it.
Yeah.
Hi, I'm Brent Curry, and about 2 years ago.
Award winner.
About 2 years ago.
Don't you love the tie?
Couldn't finish some meals, and that's unusual for me. And about 18 hours later, everything just absolutely stopped, and I had an abdominal blockage. Went into the ER. They found a golf ball-sized thing in my small intestine. Upon removing it, they diagnosed it first time correctly. First time out of the hatch as a neuroendocrine tumor. I was assigned a local oncologist with that facility, and bless her heart, very humble but knowledgeable woman on cancers in general, just not in NETs. She sent me here to start up with a NET specialist very first thing, and we came up over the next 2 months visiting a lot of doctors here, coming up with a plan. You saw a lot of decision trees. I've got my personal decision tree for what we're doing now, what we're going to do next, given other situations, what we're going to do after that. And so that's what helps me sleep at night, is having that personal plan and acting on it.
My name is Mary Dawn Levy, and I was diagnosed in 2005. At the time, had a 6-month-old and a 2-year-old, and had a Whipple, a PNET, and went 7 years clean, and then it came back in my liver, and actually in that time went on post-Whipple to have identical twin girls, which I think I might have broken a record with that one. Pretty proud of that. And then so now I've been on a trial of everolimus and sandostatin was on the trial for 6 years and still going strong with everolimus and sandostatin, 8 years, stable and doing fabulous. I'm really excited to be here.
Hi, I'm Layla Voss, and it sounds like I might be the newbie up here because I was diagnosed in 2016, so 3 years ago, and I was just a busy mom of teenagers, and my energy level was different. I thought maybe I was lactose intolerant. I started having a lot of carcinoid syndrome symptoms. And that's how we knew I was pretty sick. And I really got seriously sick for a while and had to be in the hospital, with the carcinoid syndrome. And they started me on octreotide shots and then the sandostatin monthly. It was nice to switch to that. Longer lasting, just once a month as opposed to several times a day. And I have since then been on the CAP-TEM combo, and it worked wonders for me. I feel like it was a little hard to get used to at first, felt really nauseous and not good, but I seem to have gotten used to it, and I have taken some breaks. I had to have hip surgery, and so took some long breaks for that, but have been pretty much, other than the breaks, 2 weeks on, 2 weeks off of, the CAP-TEM, and it's helped me attain stability. And so I feel just very thankful to have a good quality of life again, which I lost for a little while. So I don't take it for granted, and I'm happy to be with you guys today.
Thank you, all of you. So there's a real range of experience and experience getting diagnosed, and then what's happened since then. I want to ask you all, Brent, you mentioned a decision tree, and our theme this year is more options, better decisions. And I think that is probably the hardest choice for all of us, knowing what to do and who to trust. So what are some of the ways that you make those decisions? And is there someone close to you who helps you make those decisions? Are you one of those people who needs the tons of information? How do you go about that?
Okay, well, during my recovery from surgery, I spent pretty much full time on the couch watching Lacknet's videos on YouTube I started to figure this thing out. And in quality engineering, which was my previous career, we had a cycle called Plan, Do, Study, Act. And it's do the research, figure out what you're going to do, based on the observations after you've done what you're going to do, figure out what you're going to do for the next step, and then act on that. And so I just used that same approach to come up with what are we going to do when this gets more severe? What are we going to do when I have a gallbladder attack? Because mine didn't come out either, just like yours. And so when we do a gallbladder operation, here are the 4 or 5 other things that Dr. Mercy will be doing when they're in there. And so it was just building up a strategy. I could have done active monitoring, but I chose to do lanreotide now to see if I was going to be one of those people who would have gallbladder sludge up. And so we would know whether or not down the line we would do all that surgery line, or we would do ablation for one of the metastases that's in there now. And of course, there's always strange other things that can happen between now and, what is planned. But I plan on doing the same approach, seeing what the options are, because there's a lot of wonderful options now, as you've heard today, and go from there.
So it sounds like you did a lot of your own research. And who was your support through this, or did you consult with different doctors?
Dr. Julian, part of the interventional radiology team, Steinberg, Dr. Hendefar, Megan, the dietitian, my local oncologist at St. Jude. And I sat down with Dr. Hendefar and said, this is what it sounds like we can do. Does this make sense? Are we overlooking something, and that I should be compensating for? And he said, no, that approach makes sense, and learn along the way and see what my body is going to react to some of the therapies, so that I know that for later.
So many physicians on the team and different perspectives.
Yep.
And what about personally? That's the medical side, but what about the emotional support? And
Personally, my mom, who has been in and out of remission for lymphoma and uterine cancer, adenocarcinoma, for the last 11 years, and is in remission now, and she's here. And we show up at the infusion center sometimes the same day to get our treatments. It's a weird, well, they think it's weird, mother-son bonding experience, but that's part of the support group. A lot of prayer partners at church, and so yeah, plenty of support, wonderful friends, and then the ones I've made through this group and San Diego Nets and Redondo Beach Cancer Support Community. We're all in this together.
great, thank you. How about you, Mary? Have you had points where you've had to make big decisions? You said
So I would say I'm the opposite of Brent. I Googled what a Whipple was about 2 years after my Whipple surgery. So I know everybody, there's a spectrum, and I think we're probably opposite sides of the spectrum, but I will say that my support team is my husband back there, who honestly, I don't know what I would do without. He happens to be a surgeon, so he comes from a very different, that surgery brain, as we all know, is a little different. We learned today. Just cut it out. So there's the Whipple. But I have 4 unbelievable children that I am, pretty grateful for. But honestly, my husband is the reason. My experience of 14 years with this disease has been really not nearly as difficult as it should be. And so I'm very grateful for him. And yeah, I'll probably continue to not do a ton of research and just know I'm in amazing hands here at Cedars, and I have a pretty good attitude, which I think helps a lot, and I have Lisa Yen to thank for that as well. So that's about it for me.
So having real faith in your doctors, that they know what they're talking about, and then having a medical husband helps a lot. So that gave you enough confidence. You didn't feel like you needed to do tons and exhaustive research.
I mean, I've definitely done some research, I should say, haven't,
Yeah.
but there's no doubt between Dr. Hendafar here and Dr. Nissen has done one of my surgeries. I just feel like I'm in amazing hands. And honestly, if I ever have a question, this is my go-to girl right here. I mean, Giovanna has answered so many questions for me, and I feel like I'm in unbelievable hands just knowing her journey, and we started it at the same time, not realizing, didn't know each other then, but I just know I'm in really good hands with you.
And I have people I go to, and one of them sitting right there, Josh Mailman. So, Layla, maybe you could tell us a little bit about how has your decision process been influenced? I mean, I can only imagine if you're hospitalized with carcinoid syndrome, really feeling that could have felt very hopeless. Like, what is this? Why is it happening? How am I ever going to get out of this?
Well, I feel really lucky to have a great family support system, because when I was initially sick, I was so sick, I couldn't even think clearly. I couldn't really research and fend for myself at that point. And, I know that my parents who are here today, were really active in looking at this conference. And, my husband is a science teacher, high school science teacher. He's back there too. And, they would watch this conference online, and they were really encouraged that someone said, I'm not cured, but I'm well. And so they had hopes for me that, as I was lying in my hospital bed, not looking like myself, had lost a lot of weight, covered with rashes, just all kinds of strange symptoms. You know, they kept telling me, oh, you're rare upon rare, you know, and I would joke with the nurses, I'm so special, you know. But I just had great family support, and then it was really neat to come here to this conference. It was held at UCLA last year, and learn a little bit more. And I feel grateful that things have been going well, and I have a lot of questions now, you know, since I'm still not that far into it. I feel like this is a good learning time for me while I'm, you know, stable, feeling good. You know, I now have the health to be able to participate in the learning. So there's a lot to learn, and I'm really happy that there's new things coming down the pike that give me a lot of hope.
Yeah, it's great to know that the things really are moving along in terms of research. Did you want to
Can we
add
do a
something,
go
Brent?
back? Yeah, two other resources that are fantastic. One is the meetings like this, both the annual as well as the monthly, and we have guest doctors who provide a lot of information. And if I've got a pointed question, they're able to answer it in the hallway consult. That's one thing. The other thing is just the group among the patients, hearing the people. You asked, you know, who's been doing this for 5 years and 10 years. Those who are a few steps ahead have been wonderful sources of information as well. And personal caregiver, my sister's here as well. And so very well taken care of.
I think a lot of it we learn as we go along. I mean, obviously, all the information today there's so much there. And some of it, if you're not going to be having that procedure, you may not pay attention in the same way as if you're about to schedule that procedure. Then you'll really want to talk to somebody who's had it and get sort of real life example, just like we had the PRRT table, you know, with patients who've had it, so they can really get the feedback. Cindy, you've had 2 cancers then, and I can only imagine what it felt like to get a second diagnosis. But maybe your first experience
Yeah.
gave you already had a little like training wheels on how to do this. What was different about neuroendocrine cancer?
That's kind of interesting because actually it was a little bit of a rude awakening to be diagnosed with neuroendocrine and making an assumption that there would be a lot of information, there would be a standard protocol, there would be something that, you know, that I would be, you know, told this is how it works. Well, as all of you know, that's not the way it works. And so that was very disconcerting. I think that I'm a little bit of a hybrid when it comes to how I make decisions now. Some of it is based on the fact that when you have an oncologist who's a really great breast cancer oncologist, admittedly tells you, I don't know really anything about neuroendocrine, it's very rare. And the surgeon who did the surgery also says, did a great job, but he also says to me, I don't know anything about neuroendocrine, right? They actually did me a favor, because when you're told, you know, your doctors don't know anything about it, then you have a really good reason where, well, I need to find somebody who does. And I need to find that person, and surely there is someone. It was actually a wake-up call. About 6 months after my surgery and I had recovered, I was watching CNN, and the story came on about Steve Jobs. And I learned that Steve Jobs had neuroendocrine cancer, and I about fell out of my chair, and my husband had tears in his eyes because, you know, we were told everything's good. You're very fortunate that this tumor was found. So that was a huge wake-up call to me that I needed to be spurred into action, and so I did a Google search. And that's how I found a neuroendocrine specialist, like I said, who was right there in Nashville. And so when I saw him for the first time, his answers were very, very different than the answers I got before. He had studied in Europe. He had been recruited to Vanderbilt to specifically open a neuroendocrine program, and then he also, the things that he didn't know, he said, we'll work on, or we're seeking those answers. So I felt like I was in the right place right? I felt like that I had someone who really at least knew a lot about this cancer that a lot of other people didn't. So to me, that process was, okay, I need to be in a place where I can trust who is, in charge of my care. And that's why I think it's so important that, if you have doubts, if you're with someone who you have doubts about or you feel like they don't know that much about the disease, you really do need to get a second opinion, and you really do need to be with someone who this is what they do, and this is they understand this disease and how it works, and they also have the access to all of these new treatment options out there, and they know how to use them. It's one thing to have the shiny new tool, but you got to know how to use them. But I think the other piece of this and why I'm a hybrid is because I did a lot of things right with my breast cancer treatment as far as following, my doctor's orders and all of that. The thing that I did wrong is I did not connect with other patients. I was a bit of an independent type. And I was a professional woman, and it's like, I got this, and and when I did my chemotherapy, I was doing my work and that sort of thing, and I didn't need anybody else. And so that was a big mistake. I since woke up to the fact that there were a lot of people out there who had, similar experiences and could help me on my journey and could help me with quality of life issues, and also how to get better medical care and fight insurance and do all those things. And so when I was diagnosed with neuroendocrine, I didn't make that mistake again. I started attending patient conferences like this one. I started reaching out to other patients personally, who were in similar stages or whatever. Giovanna has been, a role model for me, Josh Mailman, others who were more educated than I was at the time. And so as a result of that, I've become more educated about the disease. And also what I do now is that, with my doctor, I started Healing Net Foundation. And so I come from an educational background. My parents were educators. And so education's always been important to me. So it was important for me to educate myself, and now it's important for me to somehow help other people receive education as well, particularly doctors who don't know. They just don't know what they don't know. So for me, my decision-making now is having the trusted physician, but also being plugged into a community and going to conferences like these, and every time I go, I learn something. I learn something new.
So you just said something about the educating physicians who don't know they don't know. As a newly diagnosed patient, how would you know that they don't know they don't know? Because you don't know.
Right, yeah.
So there's really a delicate learning curve, and knowing when. I think at the beginning, especially for someone who's never had a serious disease, that there's a sense of like, my doctor knows all. Mm-hmm. And I mean, at least that's the way I was. And it's a twist to say, oh, well, maybe this doctor doesn't know this because it's really rare. Maybe I'm going to have to travel, which is really, I mean, we think we could be in a big city, but maybe we still have to travel for that specialist. And trying to discern all of that, I think just Dr. Kasari said this morning, he's like, I don't know how people choose a liver surgeon. We don't have training for that. So how do you do that? And I found that a lot of that came, when I was first diagnosed, through other patients.
Yes,
I needed
absolutely.
to hear, well,
Networking.
this was my surgeon, and this is how it went for me. And so, what advice would you give for? We have a lot of newly diagnosed, like really newly diagnosed in the last 6 months people. What advice would you give to them? Sort of some guidelines to look out for.
Yeah, well, I think there's a certain amount of trusting your gut, in this situation, and I think. Asking a question like, well, how many other NET patients do you have, and how do you how many are you treating, and how long have you been doing this, and have you published any journals? Have you, been involved in any published articles on the disease? Do you get with other colleagues and talk about neuroendocrine? I mean, I think those are the kind of things where you want someone who can say yes to those kind of questions. And then I also think that, you know, again, by networking, coming to patient conferences like this, you pick up on things that, you know, doctors should know. Or if you hear something here that's complete contradiction to something that you've been told, I think I would lean more toward the expertise, you know, of people who are doing this on a regular basis. So I think there's a certain amount of just kind of knowing by, you know, doing your homework and by asking those pertinent questions of whether you're in the right place.
Yeah, Layla, what would you add to that, since you're probably the newest newly diagnosed?
The newest at the table.
At the table, yes. So there's some who are just, you know, only 6 months into this. What would your advice be on how to start making some of those choices?
I love to see when I'm talking with a doctor that they are happy to learn from others. And so I would try to establish a good relationship with my doctor and early on talk about, and I was able to do this, I was able to see Dr. Kuhn at Stanford, which my local oncologist near San Diego, who is fantastic, he welcomed that input, and that told me a lot about him, and I just think that's a really important trait to promote. You know, you want that trust, you want to develop a good relationship with your doctor, and part of that should be, you know, you want to be sharing new information when it comes to this rare cancer.
Yeah, that's so true. When you find an oncologist, even if they don't know a lot about neuroendocrine, if they're willing to work with an expert, then that's sort of the best possible combination. Because if you don't live right near a center, you don't want to be driving all the time back and forth to that center. But having someone who's going to sort of be the quarterback for that, your whole plan, even if you see them once a year and they're working directly with your regional doctor, is a good combination.
Yeah. If I may just say, that's what my oncologist now, the breast cancer oncologist, she works with my expert doctors in neuroendocrine. She's very open to that, and that's been a huge win for me.
And then we're helping to educate more doctors, so that just keeps growing and the knowledge base grows. Mary, what would you add to that? You've had such a long history. What would you say for somebody who's new in this room now and just hearing all of these words for the first time?
I definitely can't stress enough, obviously, being with a NET specialist, which I think everybody here after today is well aware that that's the place to be, is with a NET specialist. But I do think that you should, it's an ongoing process that should be analyzed at all stages. You know, if you've been at Cedars for 5 years, it may be time to go somewhere else. If you've been at Cedars 14 years, it may be time. Maybe something's changed with your doctor. Maybe you've heard about a surgeon that might be doing something different or unique or treatment, or maybe you have, you know, radiologists that are doing more PRT at a different facility. So I guess my point is, I've been at Cedars for 14 years, but there's no doubt my husband and I have had many conversations of, do we want to go somewhere else? You know, we haven't. Fortunately, it's been an amazing experience, but I guess don't be stagnant with your decision, you know, where you are. You should know that this is a process, and there's always other things happening elsewhere, and you should really be open-minded to going to other facilities. I just can't stress enough that making sure it's a NET specialty, you know, obviously someone specializing in neuroendocrine, and ideally someone that's had a lot of experience for me with, you know, pancreatic. So just keeping an open mind, I guess, is really important.
Great point. And Brent, would you like to add a note to the newly diagnosed, or guidelines?
Sit on the couch and watch a lot of LACNet's YouTube.
I think comedy might be a better idea, or a balance at least. You
No,
know.
I agree with everything. My local oncologist is as humble as she is brilliant and works very well with Dr. Hendefar, and I had a hiccup earlier this year, and she said, you know, take a trip to Dr. H, and that's what I did, and they just have a wonderful working relationship, and I think I get benefit from that collaboration so much.
Great. We have a couple of minutes, and I'd just like to see if anyone has any questions. This is an opportunity to talk to patients directly. And any questions from the audience? Oh, Dr. Halpern has a question.
We know he needs a microphone.
I have no idea what you're talking about.
Speak up, please.
Oh, so one of the hardest and most heartbreaking things that I see in my clinic regularly is seriously still?
I'm getting looks from the back.
So one of the most heartbreaking things that I see in my clinic is the loss of trust in the medical system that comes from the repeated sort of exposure to the fact that this is a rare and difficult disease. And what I would love to hear from as many of you as we have time for in this time is what the road to recovery looks like for getting back your faith in your doctors and your experts from that place of feeling so lost. Because I would love to understand how to help people more with that.
Wow. Friend?
I mean, I'll dive in on that. I think one of the things I really look for is the physician attending the neuroendocrine conferences for physicians, and really up to date on the latest research, things that may be in the pipeline and may not happen for a while, but really aware of the full picture. I think one of the things that break the trust is feeling like they might be recommending something that has already shown to be out of favor in the research and the journals, yet they're still recommending it because they're not up to date. So I think, I mean, on your slides, you actually, your name is at the bottom of them. I mean, you're the one doing the research, so that counts for a lot. It really counts for a lot. And knowing that, I mean, I know a lot of physicians will call their colleagues and discuss a really complicated case. So those are such extra amazing things that knowing, you're consulting your experts within your own team. Yeah. And going, this cross-institutional competition, seeing a break in that and seeing the love, that really counts for a lot.
Yeah, you want a doctor that'll stay to the end and ask questions like that, right?
Yes, exactly.
I think one of the things I found interesting was when Dr. Hendafar earlier talked about his patient that said, I'm not doing chemo. And he really listened. And we've been through, a few doctors. And I think I've definitely had those moments where I feel like my doctor's not listening to me. But I think knowing he's my doctor and he listened to her, I feel like it's important to know that the doctors are going to go through stages of maybe not hearing you because, they could be tired of you, they could be tired that day, but feeling like you are being heard, and if you if you go through the process and you're frustrated and angry because things have not gone the way you expected, is to either rebound with that physician or find a place that makes you happy, because when your gut tells you it's not right, and that's when you need to go find your happy place.
And I would just add too.
No, go ahead.
I would just add, yes, it really helps my trust to see that a doctor takes the time to research and find out about things and is knowledgeable, but also, along with what you said, it gives me a lot of trust to have the doctor really act like we're on the same team, and I think it does have to do with feeling listened to, feeling, with my oncologist right now, I do feel like he tells me what he thinks. I ask him, what do you think about this? What do you think about this course? But he takes a lot of time to find out how do I feel about the next steps? What would I like to do? And I think that I have come to expect that as a patient, that I want to find out about things and I want to bring something to the table, and I really appreciate that attitude of teamwork and collaboration, and I know that I wouldn't have the same trust if I felt that there were any arrogance or somebody who didn't think that, my perspective carried much weight. That wouldn't earn my trust, so.
I think there's two things I wanted to add to it. One is that, as I mentioned, my breast cancer oncologist did me a really great favor by saying, when she said, I don't know much about this disease. And that gave me permission, to seek someone who did. And then she was very open to collaborating with that physician, and still does. I mean, she's still a key member of my team now 14 years later, even through Neuroendocrine. And so it's because she was willing to tell me that she didn't know something, but that she was willing to learn and work with another doctor. So I think that's really huge, especially if you're not able to travel and you're not able to, go to another large cancer center that has, a team or whatever, that you have at least a doctor who is willing to work with someone else. Because we're in an age, the technology era, it's not that difficult to email and, to share information. So it's not that difficult at all. And then I think the other part of it is quality of life. I think when you're with a physician and you can tell that that physician cares about what's going on with you and how you're feeling and how it impacts your daily living and your job and all that kind of thing, that's a level of trust that you build with that doctor, because they really care about the whole and not just how I'm responding to the treatment.
And I think I'd just add 2 words to that, which is eye contact. I get it, there's computer screens, but it's really unnerving to feel like you're finally there for your appointment and this is what you're getting,
Yeah.
And I get that, how difficult it is to try to be documenting things and talk to the patient, but just leaning in and looking directly at the patient and no cell phones, nothing, no distraction, goes 1,000%. It means so much. I've heard that. We know that complaint is there, with the computers, but even if it's for, a minute, it really makes a difference. I just want to acknowledge there's something we haven't really gotten into today, which is all of the psychosocial, emotional support. And one of the things LACNETS is planning in the next 6 months is a retreat that will be exclusively on that. We're not going to be talking so much about the medical options, but really helping people understand what that support looks like. You may have your treatments, but what do you do the rest of the time? And what keeps you going? Or if you're looking at a series of procedures, how do you keep your morale up and just feel like there's hope? So that's something we'll be putting out more information on, and we're going to do one local here in LA. It'll probably be like a half-day event. I've heard from many patients, I don't know, show of hands, is that something that you struggle with? Is it would that be beneficial to address some of those things?
I'm just somebody who loves a patient, but I would love if we talked about feelings more.
Feelings, yes, feelings.
Feelings, Giovanna.
Yeah. So I think that with that, thank you so much to the patient panel. Thank you to everyone here, everyone who tuned in online, and thank you to Cedars-Sinai for hosting us, all of the amazing volunteers. You made it all possible. And to all the physicians and healthcare providers who gave their Saturday to be here. It is extra special. So we will see you next year. The conference will be in June 2020, and we rotate in LA, so we'll be at City of Hope next year. Thank you so much.
Thank you.